I'm proud today to be joined by so many who are dedicated to combating substance abuse in Wisconsin. So not only today will we have a number of bills as a progression in our multi-year HOPE agenda, but we are also excited to announce that major health insurance companies have already or have now agreed to remove prior authorization requirements for most substance use disorder treatments.
Let's clap for that one.
This reform, paired with a package of HOPE agenda bills which are on the floor of the Assembly today, are continued critical components to improving access to treatment for Wisconsinites.
Medication-assisted treatment, or medications for addiction treatment, which is a new terminology, is an evidence-based treatment that helps patients with opioid use disorder achieve and maintain sobriety, a healthy life, and productive life. It has been my experience that any delay in treatment that exceeds the window of sobriety could cause an addicted patient to relapse.
I am a person in long-term recovery, and I am here to talk just about kind of the human face of this. People have a 50% less chance of relapse when they are able to take medications for opioid use disorder, and they're better engaged in treatment. The outcomes are there, the research is there, and with this additional access, lives will be saved.
Wisconsin is a national leader and been recognized as a national leader in their efforts to combat the opioid and other substance use disorders. And today's announcement is a prime example of our state's leadership's commitment to continue this recovery.
Agreeing to this partnership are the following groups: United Healthcare, Anthem, WPS, Children's Community Health Plan, Network Health, Quartz, Dean Health Plan, Security Health Plan, and Mercy Health Plan. This will impact over 1 million covered lives across Wisconsin. Now healthcare providers can immediately begin a treatment plan in most cases, eliminating an obstacle to treatment for individuals impacted by addiction.
The HOPE agenda has resulted in 30 bills since 2014, thanks to Representative Nygren, and we are proud of that, but there is more work to do. Opioid use affects too many families in Wisconsin. 1 of 6 Wisconsin adults have received an opioid prescription in 2018. Every month, about 75 Wisconsinites die because of opioid use, and about 3,500 Wisconsinites presented to an emergency room or hospital in the past year because of an opioid use problem.
As a pharmacist, I know the impact that unnecessary prior authorization can have on delaying treatment, and we want to get these medications to people as quickly as they can.
Decades of research shows that when you improve access to medication for addiction treatment, that it saves lives. One study showed annual reduction of 30% in heroin-related mortality based on the introduction or improved access of MAT in states. So we know that it saved lives.
We appreciate the vision and leadership that Representative Nygren has shown in tackling this crisis throughout all of its branches, and now really focusing on the addiction component.
You know where I come from on this. We have never tried to think that government knows better than the doctors and the patients, and we never want to think that we know better than conversations that are taking place because of prior authorization when it comes to like a pregnant woman, like I mentioned. Those conversations should take place, and perhaps maybe there's a history of why prior authorization has been there in the past for substance use disorder, but we're in a different place today. We're recognizing that, and we're making this change.